So I am super excited to chat with today's guest. We are going to be talking about health coaching as well as mind body medicine. And so, really excited to talk to Dr. Sandi Scheinbaum, who trains people to become functional medicine health coaches. And so, really, it's just going to be a great conversation speaking with Dr. Sandi. So, let me finish up her bio that I just started here. So, Dr. Sandi helps practitioners and businesses hire health coaches because she believes that health coaches are key to combating chronic disease and reducing healthcare costs. And as founder and CEO of the Functional Medicine Coaching Academy, a collaboration with the Institute for Functional Medicine, Sandra is a leader in the field of health coaching education. And thank you so much for joining us, Dr. Sandi. Again, I'm really excited to have this conversation.
Well, thank you. It is a pleasure to be here.
Yeah, so let's dive in just with your background. Like, how did you, because I've listened to some of your other podcast episodes. I know you haven't been doing this your whole career. You you have another career in the background that used to do clinical psychologist, I think, or
Yes. So where I started is not where I'm ending up. I started back in the very early 70s in education, and I was in special education, and I spent some time training teachers for how they can work with children. That time we talked about children with special needs, learning disabilities, behavior disorders, and that led to an interest in stress management. And then I was doing workshops for parents, for teachers, for kids. I did relaxation tapes for kids on how to get a calm, quiet state. And as a result, I went back, got my doctorate in clinical psychology. And then for close to 35 years, I was a psychologist, and I was a kind of a renegade psychologist. Mind body medicine did not have a name at that time, but I was teaching people breathing techniques. We didn't call it breath work back then. And was the approach that I used was integrating all of these ways of thriving through cognitive behavior therapy, which is where you identify thoughts that are irrational and you change those, mind body medicine, relaxation strategies, and working with people with physical conditions like migraine headaches, for example. And then I learned about the Institute for Functional Medicine. And so I went through their training program. I was in the first class to actually get certified. I was the only psychologist, but now there might be a few more of us. But it was really eye-opening to learn about functional medicine. And then I was putting those principles together with the principles from positive psychology, mind-body medicine, cognitive therapy, principles that I knew were so effective in working with my clients as a psychologist, and was encouraged to start to train people who were health coaches. There were coaches coming to me, they had trained other programs, and they said, we just don't feel confident as health coaches. And so I had a co-founder, we approached the Institute for Functional Medicine, and they thought it was a great idea. They had wanted to have a school to train health coaches for some time. The right people didn't come along. And so together with IFM, we built the Functional Medicine Coaching Academy, and that's my mission. My passion today is to train as many people as possible from all ages, all around the world, because we really need health coaches to help people live happier, healthier lives.
yeah, definitely agree. And before we get into that, when you said you were the first class for the IFMCP certified from the
Yeah,
Institute of Functional Medicine. What year was that?
that was back in 2013. So
Okay.
a little more than 10 years ago now.
Okay. Yeah. We have a few things in common. So, first of all, many listening to this probably don't know this, but I actually got my bachelor's in psychology. So,
Cool.
and then I switched to chiropractic and long story, but I went to Queens College, got my bachelor in New York, bachelor's in psychology, then decided to change careers. And then also, eventually went through the Institute of Functional Medicine certification. It was 3 years later, 2016. So it was still kind of early. I guess that was 8 years ago now. So yeah, no, that is awesome. And I definitely agree that health coaches play a key role in, like you said in the bio, or I said in the bio, I'm the one who read the bio about it, combating chronic diseases, including thyroid conditions, which is what, this podcast focuses on helping people with hyperthyroidism, Hashimoto's. And, as you know, I started using health coaches. I not too well, I didn't tell you how long, but it's been about 5, 6 years since I started using them. And, they not only help to fill in the gaps, but they also help to free up more time, which allows me to see more people and help more people with thyroid and autoimmune thyroid conditions. So, but let me have you take over. Why is there such a dire need for health coaches?
Well, today people are suffering like never before. We are seeing skyrocketing rates of metabolic condition. It's been estimated that only 7% of adult Americans are considered metabolically healthy. So many people have chronic conditions. We're talking about type 2 diabetes. We're talking about the rise in neurodegenerative conditions, in dementia, Parkinson's, which is just off the charts, like we've never seen before. We're also seeing our children affected. So when I was in special education back in the early 70s, it was considered very, very rare to have a child with autism. In fact, I supervised student teachers, and for an entire county, this was the northern suburbs of Illinois, there was only one class for children with autism where they would pull them out of the regular classroom. And there were so few children. We're talking about the incidence, it was extremely rare, whereas now it's very, very common. And we're also looking at skyrocketing rates of anxiety and depression. And unfortunately, there's a huge shortage, particularly in mental health professionals. And so that's where coaches can really step in, because they are not psychotherapists, they are not psychologists, they do not diagnose any medical or psychiatric condition, they don't do psychotherapy. They help people with emotional wellness, with regulation of their emotions, and help to just being listeners. Because first and foremost, that's what health coaches are trained to do. That's what they are the experts in, listening. And when you feel heard and understood, and you have that relationship with your coach, that alone can be very, very healing. And you end up leaving that conversation feeling better. And then when you combine what coaches can do in terms of encouraging you and guiding you for behavior change and changing habits, like perhaps you're moving more throughout the day, you're going out and taking walks. Well, that's a great antidepressant, for example. So there are just so many reasons that health coaches are needed now. And we also have a doctor shortage. Good luck trying to find a new primary care doctor. So my thing is the health coaches are the new primary care. And why do I say that? It's because lifestyle should be first. That is the first line before you consider anything else. What about someone's day-to-day habits? What kind of foods are they eating? How are they moving throughout the day? What's their sleep like? What's their stress level, their relationships like? And those are the areas that health coaches can address.
Yeah, so just to confirm, I know you're not saying that health coaches are going to replace one's primary
Absolutely.
care doctor. It's just that, and I agree with you. We want to focus on diet and lifestyle, because typically when you go to a primary care doctor, many times they're just going to give a prescription, which there's a time and place for that. But for many people, I mean, arguably, everybody needs to eat well. They want to be active. I mean, it's the mind body medicine, which you'll talk about, component is important, which I don't know of any primary care doctor who will sit down with you and talk about mind body medicine, let alone talk about eating a healthy diet. I mean, there are some functional medicine doctors who practice primary medicine who I'm sure do that. But on average, you're not going to expect that when you go to a primary care doctor. So I agree. And especially if someone's going to have to wait, whatever it may be, 3 months, 4 months, 6 months, during that time. If you do need to see a medical doctor, obviously, if it's an emergency, go to the ER. But if you're waiting for just to get established and get a physical, why not see a health coach and have them, like you said, they're not gonna and we're going to talk about like the don'ts, what they can't do specifically. But as far as listening to you, giving you encouragement, maybe reviewing what you're doing from a dietary and stress management perspective, of course, help to hold you accountable. So but yeah, what can, I mean, if you want to, I don't know if you want to further expand what they can do, but I definitely want you to talk about what differentiates a health coach from a medical doctor or other practitioners.
Absolutely. So we refer to this as their scope of practice. Health coaches at the present time do not hold state licenses. They are not licensed medical providers. So that's why they don't keep medical records. They are not the ones who provide a diagnosis. So a health coach is not going to diagnose you with hypothyroidism. They are also not going to have a treatment plan for you. They are not going to prescribe, certainly not medication, but even things like supplements. They do not write out a meal plan because unless, now I should have, there's a but many health coaches do hold those licenses. We actually have medical doctors who train with us. And so if they have that license, if they are a nurse practitioner or they are a registered dietitian, in addition to being a health coach, that would be different. But health coaches, unless they hold that license to practice medicine, for example, they do not order labs. They do not interpret labs. They're the educators. And that's a very important role because somebody might get a lab result back. And increasingly, we're seeing people going to direct consumer lab companies. They're getting assessments, they're getting these results. The health coach doesn't say, based on that, you have a vitamin D deficiency or looks like you are type 2 diabetic. They are providing the education about what each test means. So, okay, here's your hemoglobin A1C. This is what this test measures. What are your thoughts about, you've seen, and then there might be you might seen changes, like it was at one point a year ago, now it's at this point. And so a health coach asks the right questions, like, what are your thoughts about it? And that leads to, how can we work together to change some of the behaviors that might be driving these lab results? So that's where the health coaches intervene. There are programs that say, and you might see this advertised, like, oh, become a health coach in 3 months and you can order labs as a health coach. Well, that is not true. You can do that, but it is out of your scope of practice. You didn't go to medical school to learn about the rare medical conditions that you might not be able to pick up. And so what we do is look at all of the things a health coach can do, and not get into those territories that are out of their scope, because the value is in collaboration, which you referred to earlier. So our health coaches are collaborating with the medical doctors. They might have clients and they might have a consult with a medical doctor who is the expert in ordering and interpreting those labs, for example.
Yeah, and that's exactly how it works in our practice. When with the health coaches, they don't actually order labs and they don't give the recommendations. I mean, when it comes to especially like supplements and even diet recommendations, initially,
Mm.
I consult with the coaches, and when it comes to each of the patients, and the patient has a pretty good idea of what diet to follow after the initial consultation with me, and the health coach may review the recommendations. And same thing with the supplements. The recommendations for supplements come from me, the lab orders come from me. So yeah, I agree. I know that there are coaches out there who are doing those things, but you're just saying that they shouldn't be doing them if if that's all if they're just the health coach, and if they're, let's say, working on their own and they're recommending labs and supplements, that pretty much that's out of their scope of practice, as you mentioned.
Correct.
Yeah. So, and you mentioned asking the right questions, so that's important, and being good listeners. So, those are some great qualities and important qualities of a health coach. And so, you mentioned also that, like, the duration. You gave an example of someone just y- went through a 3-month coaching program and then ordered labs. But forget about the ordering labs. Just talk about the duration, because there are different lengths of different programs. 3 months is kind of on the shorter side. I don't know if there's any real certifications that offer it that quickly. And I'd be a little bit nervous about seeing someone who just went through that. I mean, I guess unless if they were trained also by a doctor and not just, but let's talk about the program, like from the Institute of Functional Medicine, because I think it's a 12-month program, right?
Yes, so our program is 12 months. And the reason is because human lives are at stake here. And in order to have the skills, in order to have exposure to all the nuances that have to do with when you have an encounter with another individual, it takes time to feel confident and also to learn things like motivational interviewing, like appreciative inquiry. So let me backtrack. Health coaching came from life coaching. You think of it like a spin-off from life coaching. Where did life coaching come from? That came from psychotherapy world, specifically humanistic psychotherapy, which was very big when I trained late 70s, early 80s. It was Carl Rogers, for example, Gestalt therapy, and this notion of client-centered, where you as at that time as the therapist, you are not in the driver's seat. You are not telling that person what to do or what's wrong with them. You are listening, and the conversation goes in whatever direction that client wants to go. And you have unconditional positive regard for that individual. Now, where does this become problematic? In health coaching, with a health coach who does not have that kind of rigorous training such as the what we provide. Maybe they went to a course 3-4 months and they learned from an expert for many coaching programs that are established out there, and they are just thinking, well, there's an orientation, like everybody should be paleo or keto or whatever that their orientation might be. So as a coach, then what's going to happen is you're going to come out of that program. You're going to, I'm a vegan or I'm a paleo, and everybody should be then. That's the healthiest way to go. So now you are taking your belief system, whatever that might be, and you are, even at an unconscious level, you're communicating that this is what that client should be doing. That's not unconditional positive regard. That's not client centered. So, health coaching, following this humanistic approach from psychotherapy, means that you are sitting with that individual. And for that encounter, you are so mindful that is your whole world. And you are asking the right questions so that that client has that aha moment, like, yeah, maybe what I'm eating or not eating, maybe that is impacting how I'm feeling and my energy level. So I think I'm going to give it a try. I think, but they come to that conclusion. It's not the health coach telling them. Health coaches, as I said earlier, they can be the educators. They can give their opinion, but only if that client wants it. It's never forced on them.
That makes sense. So the timing of this question is good, because I just came out with a book called The Hyperthyroid Healing Diet. And despite the name of the chapter, it's not just one single diet. There's 3 different diets. One of them is kind of similar to like an autoimmune protocol. Another one similar to, let's say, a standard paleo diet. But let's say, so the health coach, if the health coach is going over these diets, he or she wouldn't say, okay, you have Graves' disease or Hashimoto's, you should follow an autoimmune protocol. Rather, they should say, these are the options. And, many of our patients maybe follow an autoimmune protocol, but some of them follow these other diets. And ultimately, it's up to you kind of to make the decision. Would that be accurate? Or?
Absolutely. So it would be, here are here are the diet plans. And you are giving those because they are created by you, Dr. Eric, the expert. And then you encourage the client to be the detective, or possibly to go back and think about in the past, like, when did you feel best? Like, if you eat these particular foods, what happened in the past? How did you feel the next day? And they might have some insights into that. Or they might say, okay, well, I never did well, or I could never stick with a food plan that had this food, or I don't like the taste of it, or they're going to arrive at that decision. And also, more importantly, they're going to arrive at where they want to start. A perfect example is the elimination diet. So this was a diet that was developed by the Institute for Functional Medicine, and our coaches are trained in how to guide people through, where you eliminate for 3-4 weeks those foods that are likely to trigger a reaction. And it can be challenging because you're asked to give up coffee and chocolate and so many foods and beverages that you may depend on. And so we actually did a randomized controlled trial with IFM. It was published in the peer-reviewed journal Medicine. And what did we find? We found, and this was for people who were going through, these were medical professionals going through IFM's initial training course. And they were asked, it was volunteer, to try the elimination diet, because if they're going to be teaching it, recommending it to their patients, it would help to have that personal experience. It was hard for them. How can I give up my coffee, for example? So we paired our graduates for 5 sessions of coaching. The group that got the coaching, the compliance went up. The waiting room control group that just got the guides, a PDF guide to the elimination diet, did not do as well in terms of their compliance. So it does increase compliance, and it also, with that individual being in the driver's seat, what does that mean? They might tell you, this is when I'm ready to start. I'm not ready to start. Or this is what I can do. And then perhaps it's starting very small. And the coach will then say, how can I, how can I help you? And often it's accountability, where we're going to chat again next week. And I'm going to ask you how that went, giving up your coffee. Or maybe it was, I'm going to do half decaf. That was, what they can tolerate. That. So it's always listening to the client. Where do they want to start? When do they want to start? What are going to be the potential obstacles? How can I support you?
Yeah, it's great points, because everybody's in a different place. Some people might be used to eating fast food every day, and they might not be ready to start a strict elimination diet, whereas others, people work with me all the time and they've already done it on their own. They've made a lot of dietary changes. So again, it does depend on the person, and some people might be ready to do it except for coffee. You mentioned coffee, or maybe the dark chocolate. Usually it's the coffee, if anything, that they don't want to give up. And so it
Yeah.
might be, okay, well, let's compromise. And, again, ultimately it's up to you. It's even if, and again, a health coach can't say this. I guess I could say, this is the diet I want you to follow. But even if I said this, it's up to the person ultimately, because I'm not going to follow them around, their home or whatever. So really, ultimately, it is the person. So if I say my preference is for someone to follow, an autoimmune protocol or a paleo diet, but then that's part of the health history too, because usually the person will say, well, I don't know if I could give up my coffee, and then we might have a conversation, and then again, honestly, them and the health coach, that's where they get into a deeper conversation with that, because that's usually what I have the health coaches talk about. But sometimes I'll bring it up to me as well, as far as, do I have to give up gluten? Do I have to give up the coffee? And then I'll give them my opinion, but then I also will say, well, you could also talk to the health coach about that. And yeah, so what you said, I completely agree with. So thanks for sharing that, Dr. Sandi.
Yeah, and
So
nine times out of 10, it is what you don't want to give up, what you're resisting, that's probably doing you in. So if they say, oh, I can't give up bread, I can't give up, that's probably the culprit. The same with coffee. And maybe now with people having Aura rings and the tracking, they might notice, oh, let's do an experiment. See, can you go, a couple days without coffee? What would happen to your sleep? Are you getting better sleep? And then they have that aha moment. Oh my gosh, I did see that connection. So I think I can do this now.
Yeah. No, excellent point. If someone's like a little bit hesitant, like, I'm not sure. But if they're like, I just can't give up the coffee and they're drinking 2 or 3 cups, or again, the gluten, then you're right. Many times that's probably the at least one of the things that they probably need to take a break from or eliminate. So that's a excellent point. So I wanted to talk to you about the different ways that health coaches are used, because in my practice, a lot of it is one-on-one, but there are group options too. So like what do you see other practitioners do, or again, even maybe some health coaches who have their own practice, but as far as seeing people one-on-one, like how many sessions do they typically see on average, or is there a recommended number of sessions? And then how does it work for health coaches who help people in a group setting?
Sure. So, first of all, how they can work is multiple ways. It can be in person. They can come into the office. We even have some coaches who make home visits. They help with pantry makeovers, for example, or hands on kind of cooking if they have that background in cooking. But most of the time, it is now increasingly remote. So, health coaches, because they are not licensed by the state and they don't have the regulations as many practitioners do to only work in the state or states where they hold a license to practice, as non-practitioners, they are not bound by that. So they might be, I'm in Illinois, and if I'm a coach in Illinois, I could be seeing somebody in California, in any part of the world. And so that allows practitioners who have health coaches to expand their reach, because their health coaches can practice out of the state where they, for their own medical license, may have more restrictions. They can be one-on-one, but increasingly they can see people in groups. And I love groups. And we teach people how to do group coaching. In group coaching, the community is the healing element, is the medicine. We feel like we're not alone. When we're in a group and we are with others, it is, wow, if this person can change, I can too. So there's that social modeling and the impact of going along because you are in the group with the group norms, and so you're more likely to change. It is a wonderful way of working. And this is also group medical visits. There are a lot of practices that are insurance based, and this is something that can be billed through insurance. There's ways that the doctor or the nurse practitioner can take people out of the group for breakout sessions where they have that individual time, and then they bill for that through the through the health insurance system, and the coach is facilitating the group. And the number of sessions, we have found that the sweet spot can be around 5 to 8 sessions is really enough time. And then often there's some check-ins. So and again, because it's client-centered, how do you want to check in? For some people, they say, oh, text or email, or it's a phone call, for example. So it's highly variable how many sessions. But again, the average tends to be around 5 to 8. And that depends on what's going on, if depending on the chronic condition, and sometimes people may work on one issue and then that's resolved, and now they want to go on and work on something else.
And how does it work, I guess, I'm sure you're familiar with HIPAA and patient privacy, because that's, I guess, been a concern as far as, I mean, I do group coaching calls, but the way I do group coaching calls, honestly, they don't interact with each other. They don't, I mean, it's when I just finished a 5-day challenge, which was for not patients, just the general public. And that everybody was on Zoom and we had a Facebook group and everybody was interacting, but they're not patients of mine. When I do a group call with patients, they're not seeing each other or communicating because, again, I'd have to have their permission to do that. So is it similar with the health coaching, group health coaching, where you would have to get like everybody who joins a permission that it's going to be in a group setting and they will be interacting?
Yes. So it's usually best if you're a practitioner, you want to run a group, or if you're a health coach listening. So you have that first session with somebody and that's a private session, to explain why coaching in a group is a good choice for them. And you go over the rules of engagement. And one of the most important rule is that you are going to abide by HIPAA. Now, I should point out, because health coaches are not what's called covered entities, they don't hold medical records, and so they're not legally bound by HIPAA, but they're ethically, morally bound. And so through the National Board for Health Coach for Certification for Health Coaching, it's NBHWC, they are, if you're a board certified coach, you abide by the rules of that professional body. And that includes abiding by confidentiality. So you are not going to disclose anything that is revealed in your health coaching session. That's a given. When you have a group, what you would do if you're leading that group is you go over the rules, just like it's a classroom, and there's you want to have that, speak in a courteous way. There would be no talking over somebody else. You want to be respectful of others' opinions, for example. And so these are the standard, like classroom rules. And a big rule is that what is heard in the room or discussed in that setting, it could be a Zoom room, stays in that room. However, because each individual who's in the group, you have no personal control over them. And so somebody may go out and post something on social media. That's very rare, because what happens is the group, they become close with one another and honor bound. And so you would go through those rules every time that you start the group, just to remember that what we share stays in our group room. And so people do abide by that, but it is not legally bound. So somebody who goes out and maybe inadvertently disclose something, we're not legally bound, because they're just private individuals. They're not medical practitioners violating HIPAA.
Okay. Thanks for explaining that. And are there any other roles that you see health coaches play besides what you mentioned, the one-on-one, and either in person or remotely or working in a group setting?
Yeah, so some practices, the health coach is actually, so if you're a primary care doctor, your health coach might be in the session, in your visit, and they are the ones assuring that people understand what's recommended, they understand the diagnosis. And so some practices use health coaches that way. And increasingly, we're seeing health coaches being the advocate, the patient advocate. Because if you are going through the conventional medical system, you may feel overwhelmed, especially people who are not technically computer savvy, and they can't just call up the old-fashioned way. Maybe they had a primary care doctor, and you just pick up the phone, the receptionist answers, you make an appointment. It's old school. And now you call, and it's this huge medical conglomerate. And you are just feeling lost, in this system of talking to robots. And there's it's very stressful, I should say. And so a health coach can really help you with that. Often, if you are a health coach and you have your own business, a health coach can help you with referrals to specialists, for example, finding a functional medicine doctor, or if you are dissatisfied with the care you're getting. I suppose you do have your medical team is in one of these huge hospital conglomerates, and you just feel you're given 7 minutes, and they're not really they're ignoring, what you really wanted to discuss. A health coach can, again, help you find that right practitioner, or they are the ones who are your primary contact and can help you, again, navigate this increasingly complex medical system where you just feel like a number.
Yeah, thank you for sharing that. So yeah, a lot of different roles that health coaches can play. And before I want to talk with you a little bit about mind body medicine, but before
Sure.
we do that, is there anything else that I should have asked you that I didn't ask you about health coaching? Anything that you have a burning desire to talk about that you didn't talk about?
Well, I should say that if anybody is listening and they are thinking, gee, I think I would like to be a health coach, there again, we need so many health coaches because of people getting sicker and sicker. And this is a role, a career, or if you're a practitioner and you learn health coaching skills, it brings meaning and purpose to your life. It is, you are personally transformed. We know that when every session, it is client and coach who are personally transformed. It's not like you are the teacher if you're the coach and the client is the learner. You are both the learners, and that's what makes you're learning that person's story, and it's also, again, a personal transformation in the process.
And usually towards the end is when I ask, how can people find out more about you? But I'm going to ask you to do it now also, and then we'll do it at the end. So it's functionalmedicinecoaching.org is the website for those
Yes.
who are interested in learning more about becoming a health coach.
Yes.
Okay, wonderful. So mind body medicine. So what's your definition of mind body medicine?
Yeah. Well, this was a saying that I started to describe way back in the late 70s. What's real in the mind is real in the body. And that is mind body. You can't separate everything, every thought, every emotion that you have is going to either be inflammatory or anti-inflammatory. It goes to the cellular level. That was just a wild hypothesis back then, but today we have the advanced technology to really show that that happens. It affects our microbiome. It affects, again, our cellular functioning. And so what you picture, what you imagine, the power of imagery, the power of what you are experiencing and how you are defining your circumstances goes so far in terms of your your physical well-being. And so it's remarkable how many ways that you can impact your physical health.
And so a two-part question. So what type of mind body medicine techniques do you recommend? And then what do you personally incorporate?
Yeah. So it always does start with breathing. We hear a lot about breath work, but sometimes some of the strategies that are out there can actually be detrimental. If you perhaps are prone to panic and anxiety, you can induce a panic attack if you are working some of the breath work where you become hyperventilating. And the easiest, the most effective way is to just notice where your breath is coming from. And so you put your hand on your stomach, you put your hand on your chest. Are you initiating with the diaphragm, which is you push out your stomach, this slow belly breathing? James Gordon talks about it as soft belly breathing. So where you just become aware of where you're breathing from, and then you become aware of how fast you're breathing. Are you racing your breath, or is it very slow? And from there, for me personally, and I've taught this to thousands of patients as a health psychologist, it's using imagery. So as you feel the breath, what images occur to you? And so whatever direction your mind goes, that's what is at the moment. But it can also be an image that or a sensation. You feel, you imagine the warmth of that breath. Where does that lead? It leads to warmth in your heart. That's actually a heart math technique for better heart rate variability. So as you take these slow, deep breaths through your belly, and as you exhale, you imagine they're warm, and the breath, that warmth is flowing through your heart. And now you're sending the warmth through your heart out to all parts of your body. I personally love a strategy, which is again very old. It's fun. I don't see it very often, but it is autogenic phrases. This is, in a nutshell, self-programming. What does that mean? You repeat some things over to yourself, maybe 2, 3 times, like, I am, my feet feel loose and relaxed. My hips and thighs are feeling loose and relaxed. My breathing is slow and regular. Warmth is flowing down my arms into my hands and fingers. You keep repeating these, and it can be whatever you think about, wherever areas need a bit of extra love. So I go through this, and I might focus on my adrenal glands, I kind of talk to them, or I'm talking to, for example, my digestive tract, and imagining all of the good bugs in the microbiome and just giving them some love. So that is the power of imagery. Some people use external imagery, like imagining a beach, a mountainside, whatever appeals to them. And again, this is so personalized. It's not one size fits all. Then there's progressive muscle relaxation, another very tried and true technique. It was developed in the 1920s by Edmund Jacobson, where you're basically taking each body part and you're squeezing and tightening as hard as you can, so that when you release as much as you tightened. Did that for kids. They loved it. Where they tighten up and squeeze, and then notice you're holding your breath, and then you let go. These are very simple strategies that you can incorporate into your daily routine.
I heard you mention heart math. Do you use it? Do you utilize heart math on your own or with clients or?
Yes. So I used to use it quite a bit. In fact, I trained back in the day with, when it was first established. And you're impacting heart rate variability, which are those beat to beat movements. But it's actually between each heartbeat. It's not the heartbeat itself, and has been highly correlated with a quieting response.
Yeah, I use the inner balance, and I
Mhm.
have
So,
the M Wave 2. I don't use it as I use the inner balance pretty regularly, but the M Wave 2, I for my computer, I can't I mean, not that you need to use both of them. One of them is sufficient if you choose that, but yeah, that's great. As far as thanks for explaining some of the different things, different techniques people could use. And how long I mean, well, another two-part question. One, do you utilize mind body medicine every single day? Is it just like 3 days, 4 days a week? And then when you do utilize it, like how long is an average session? Or is it like spread out throughout the day where you do it 5 minutes, 3 times a day, or just a single session of like 20, 30 minutes, whatever technique you end up using?
yeah, I do it the same way I approach exercise, as snacks throughout the day. And then I might have a longer session. So I was never one to do, oh, I'm going to meditate 20 minutes a day and just sit there and see what comes. I am very full of zest and hyper. And so that never worked. I need something more structured. So I might do a meditation walk, for example, or I take ballet class, and that is very in a meditative state. As far as practicing relaxation techniques, perhaps if I'm out in the sun and I'm feeling the warmth of the sun, that's just going to lead to just a few moments of going through this. If I'm sitting in a sauna, I might go through that round of autogenic phrases. But most importantly, it's throughout the day. If something happened that was potentially stress producing, like before recording this podcast, I always like to check, do I have the call in? And so I checked on my phone, and I didn't see anything. And so there could have been that moment of stress, like, oh no, what if I don't have the link and I'm late to getting on for this interview? Luckily, I did find it on my computer, so it was all good. But that is where you say to yourself, or what I said to myself, which comes from cognitive behavior therapy, because those I consider relaxation strategies as well, would be okay, so what if I don't have the link? I have Eric's email and I'll get it. Or, okay, what if I can't get a hold of him? What if I'm late? Well, what's the worst thing that can happen then? And often you take it to the nth degree. Is this worth dying over? Now, and at my age, I'm 74, I hear almost every day of people, my contemporaries, who have passed away. So really, it's that perspective that is also very important to practice, to say, what will this matter? Will this matter in 5 years, in 10 years? Will I remember this? Because we tend to upset ourselves and get into this stress response over things that are relatively trivial in the long run. And I see this, I wear a CGM, and for me, what causes those blood sugar spikes, not the foods that I'm eating as much, because I eat a really healthy diet, but it is those variations in terms of potential stress that's going on.
All right. I'm glad you said that about spreading it out throughout the day, just because I think some people get the impression that you have to do it like 20 minutes, just like some people exercise. I mean, I'll admit when I exercise, it is all at once. Like I can't say I spread. I mean, try to move throughout the day, but if I'm doing weightlifting, it's usually blocking out whatever time, an hour to do the weightlifting, and it's not spread out through the day. But some people think it has to be the same with mind body medicine, and that you have to have larger chunks. And what I encourage people to do is just get into the routine. If you're not doing it, just start with 5 minutes, just not, and not try to do 15, 20 minutes at a time, because it's going to be more difficult to so I'll start that routine to begin with, and then for some people stay in that routine. But really, it's just about getting started. So I'm glad you didn't say that, yeah, everybody should be doing like 20, 30 minutes a day consecutively. And again, some people, it's fine if they do that, eventually build up to that, or if people are listening to that and they're already doing it. I don't think there's like one way that everybody should do it. It's different. But I'm glad you said that it gave your perspective that someone can do smaller chunk, just like 5, 10 minutes multiple times per day, can be just as effective as blocking out 20, 30 minutes just to incorporate mind body medicine.
Absolutely. I used to teach people to take 30 seconds, a minute, in between answering, in between emails, or you set a timer, or the times when you most need it. Let's say you're in an airport, you're waiting for your luggage to come off the carousel, and instead of checking your phone, do some, shoulder rolls and breathe at the same time to let go of tension. It's often when you most need it, at those times, that you can just do this quick relaxation response.
Definitely agree. Thank you for sharing it. Anything else on mind body medicine before we wrap this up?
It is the most powerful tool. It is really something that you have within you. Because your mind and body are always interacting, but they may be producing a stress response. They can be turned around to produce a profound healing relaxation response.
Yeah, definitely agree. And going back also what you said about the continuous glucose monitor, that you notice more of the stressors than the diet, because you're eating a pretty clean diet, but the stress also could affect obviously blood sugar, adrenals, and so yeah, I'm glad you also mentioned that. And yeah, this was an amazing conversation on both health coaching as well as mind body medicine, Dr. Sandi. Again, as far as people finding out about you, I'll let you take over. The website, if you can mention again, if there's anything else you'd like to drive them to, definitely feel free to share.
Functionalmedicinecoaching.org is the website. If you're on Instagram, my personal is Dr. Sandi. That's DrSandi. At Functional Med Coach is our main Instagram site. And those are the main places that you can reach us. Also on Facebook, Functional Medicine Coaching Academy.
Wonderful. Well, thanks again, Dr. Sandi. Again, I really enjoyed this conversation. I learned some things, and I'm sure the listeners did as well.
Thank you so much.